What's interesting is that a lot of people do wait way too long before they start psychotherapy. I think there's that general impression out there that therapy is only if something's already gone horribly wrong or you're already in a mental health crisis, when the reality is that you need to be using these tools and get to know them long before the crisis hits. So yeah, I understand why we're in this situation, but it has to change really, because our nervous system is a beautiful piece of machinery, apparatus, whatever you want to call it, and if we learn about it and we stop fearing the kind of bodily changes that come with different states, then it's going to be a lot easier to ride those ups and downs of life. Also, the thing about CPTSD is that it's not a deficiency in any way. Some people pathologize this label of complex PTSD, post-traumatic stress disorder, but it's actually it's simply an adaptation. We've been in environments that have been hostile or unsafe or constantly shaming, and so we've had to adapt, and that's where the beauty of the nervous system and mind comes from, that we've actually kept ourselves alive. Our nervous system has done what it's supposed to do. We've scanned the horizon, remained hypervigilant for the next slap or the next public shaming exercise, or we shut down or we dissociate, because if we felt all of that pain in the moment, then we would just be overwhelmed. So we have these coping strategies that have been developed for very good reason. And it doesn't mean that we're broken. It's just, look, the nervous system is doing what it's supposed to do. And also, another thing is that people think, oh, I'll wait and then I'll start to talk about it. But often with nervous system dysregulation, trauma, CPTSD, talk therapy is not enough. We really need to adopt some kind of somatic approach, use EMDR, polyvagal theory to really understand. Yes, understanding is good, but then also to change our bodily responses each time we get triggered. Somatic approaches can help us reconnect with our bodies and learn that what we're feeling is tolerable. I always talk about this kind of peak or the wave that we have to surf, that when we're starting to feel dysregulated, that anxiety level it's peaking, and often we fear that and then we pull out or we kind of avoid, when actually we learn to lean into it and we can ride it, and then we come out the other side and our brain learns, oh, we're feeling a dip now, we're starting to feel calmer, regulated. It's also what EMDR helps you to do. You can keep going through it. The intensity levels of the distress go all the way up to 10 out of 10, then down to 9, 8, 7, 6. And if we stay with it, stay with those eye movements, it gets down to a 0. We get to the other side and we realize we're still the same person. We've survived. Polyvagal theory can give you an understanding of what your nervous system is doing in any particular state. If you're fight or flight, it's going to be a faster heart rate. If you are on the shut down dorsal vagal, you're going to feel numb or absent-minded. There is a big cost of waiting too long. If you wait and then you're in survival mode, then you go and engage with therapy. Sessions are just going to be focused on stabilizing you and containing the stuff that you're bringing up, putting out fires. That work is important, but it's not the same as having the space to explore, integrate and grow, to really thrive in your life.